3, 2.
Welcome to Westchester Jewish Community Services. As a leading agency in providing a comprehensive spectrum of human services, we have been helping people since 1943. We serve all people in Westchester County, regardless of age, income, or ethnicity. We provide a wide variety of essential and dynamic services that make a difference in people's lives. Children, teens, adults, and senior citizens are served by our network of programs located throughout the county. When people come to us for assistance, they become part of the WJCS family. Our highly trained and skilled staff focus on you and your family and are committed to becoming your partner in finding solutions. For more than half a century, we have been connecting people to services that help them overcome mental, physical, or emotional challenges. WJCS is here in your community when you need us.
Welcome to the Ways We Care of Westchester Jewish Community Services. I'm Dale Wang, Director of Community Relations. WJCS is funded by government grants, private individuals and foundations, UJA Federation, United Way, and corporations. We live in an era when it is hard to feel safe, even in our everyday lives and routines. Not only do we sense our vulnerability to terrorist threats, but we are increasingly fearful of predators who threaten children in our neighborhoods and over the internet, youngsters who may act out violently in schools, and even clergy and school personnel with histories of abuse. Among the most fragile are people who have already suffered trauma or who have been victims of abuse. While most of us are able to continue our daily pursuits with increased vigilance, children and adults who have experienced trauma situations need extra supports to enable them to find safety and trust again. The WJCS Treatment Center for Trauma and Abuse helps people cope with the aftermath of violent or abusive situations. Our specialists also work with youngsters at risk of antisocial behaviors at an early age to prevent future incidents. Tonight we will speak with 3 professionals from the treatment center who employ innovative techniques and informational services to help victims and educate parents and communities so that they can maximize the possibility of keeping our children safe. We also have a very special 4-legged guest, Zoli, who works with our treatment team in animal-assisted therapy sessions. I'd like to introduce our guests tonight, Pat Lemp, who is the director of the Treatment Center for Trauma and Abuse. Thank you for joining us again, Pat. And Roberta Schaefer, who is a therapist with the Treatment Center and who does special animal-assisted therapy with Zoli, our 4-legged friend. I'd like to just start, Pat, by giving people an overview of the Treatment Center for Trauma and Abuse. With growing concerns about safety, especially for children, I imagine there's been increased demand for services and intervention services. Can you give us an idea of the scope and types of treatment that you get involved with?
Sure. The Treatment Center for Trauma and Abuse is actually an umbrella term or an umbrella program that oversees several programs in 3 of our offices in central Westchester, in Hartsdale, in the southern part of the county in Yonkers, and in the northern part of the county. Our most recent addition is in Peekskill. And at that site we have therapists who work with children who have been sexually abused and with their family, the non-offending parent, and we also work with offenders. We also work with victims of domestic violence, and we work with adult survivors of sexual abuse. So, and as you mentioned, Dale, our newer programs are working with children at risk of being sexually aggressive. We have a program specifically for adjudicated juvenile sexual offenders And increasingly, we're seeing younger and younger kids who are sexually inappropriate, and our newest program is working with kids who are not adjudicated, but who have been sexually inappropriate.
So now, most of the clients come through what types of referrals? How do people come to us?
Actually, we're pretty well known in the community now. We work closely with schools, with Child Protective Services. We have some referrals from families themselves, word of mouth, because we have been in the community now for more than 20 years. Doctors, probation department, many, many different referral sources.
So there have also been, increasingly, I guess, after 9/11, other issues that the treatment center has gotten involved with. Can you talk a little bit about some of those types of trauma situations that you've been involved
Actually,
with?
even prior to 9/11, we have been in the community and in schools to respond to crises. So, for instance, in schools where there were allegations of sexual abuse, if there were allegations of sexual abuse by a teacher, that certainly precipitates a crisis for the whole school, for the parents, for the children, and for the faculty. So we have several times gone into schools, set up intervention programs, offered crisis intervention, and worked with the faculty and with families in trying to help them deal with a very difficult situation. Similarly, post 9/11, as you mentioned before, often trauma survivors, people who have been previously traumatized or have post-traumatic stress, they're more easily reactivated or more easily made anxious when there's a crisis. So in addition to seeing some people who were actually directly affected by the tragedy at the World Trade Center, we also had many people who had previous victimizations and not just, because it certainly was powerful for all of us to witness on television, the trauma of the World Trade Center, but people had their original traumas, their original pain, their original crisis reactivated. So we saw many people who didn't know where to go, didn't know what to do. We also saw many parents who were looking for advice about, number one, how to kind of calm themselves, and then how to take care of their children, what to offer their families.
I think that part of what we're going to discuss tonight is really how parents can really begin to get beyond some of their own fears and help their children cope with anxieties and fears and some of the stresses. While we have Zoli here, I think that we should move on to our first topic for tonight, which is animal-assisted therapy. Can you give us a sense of how this got started within the treatment center and why you felt that this was something that would add to the mix in a positive way for, I guess, mostly children that have been abused?
I think it somehow evolved. When I came to work at WJCS in 2001, I was coming from a residential treatment center in Brewster, where the work was with many traumatized children that lived there, and 380 abused or abandoned, neglected farm animals. So I had seen the work and I had seen the power of healing animals and children. When I interviewed for WJCS, I knew it was working with children who had been traumatized, but I didn't think I'd be able to incorporate the animal-assisted therapy. There was no farm, there were no stables, but I thought, eventually I'll just get it in there. So after several months, and talking to Pat, we decided to have her start one day a week working with me in sessions, and as long as it made clinical sense, which is important, and that's how it got started, and that's about 3 years ago.
How do you decide that it is appropriate to bring a child into therapy with an animal? Who are the children who would benefit from this type of pet-assisted therapy?
Well, probably most kids would benefit, but I think the way we select is the ones that are really hard to reach. And, we've had some kids come through who have talked to many therapists and just don't think, there's anybody that can help them. They've gone into a shell. They're very depressed and withdrawn, and talking, and another person is just another person to talk to about my problems. How are they going to help me? So pretty much on the basis of that, since she only works one day a week, We really try to match up those that, that's just no contact with a human alone is really going to impact them.
What is it that engaging the dog in the treatment, what is it that you are able to bring out that doesn't really evolve when you're working one-on-one with a child?
I think initially it's just the ability for the child to build a relationship with the animal. Most of our kids have been hurt by people in their lives, people that they trusted, people that took care of them. So for them, people hurt, and relationships have been a source of pain. An animal, is usually very accepting, non-critical, no strings, so it's much safer to attach to the animal. Eventually, the child will then be able to form a relationship with the therapist, and then eventually take that ability to be in relationship outside of the therapy room.
The types of abuse that children have suffered who might go into therapy with the animal, what's the range of diagnoses that you might feel are appropriate?
Actually, I think almost any child can benefit from the intervention of animal-assisted therapy. We work primarily with children who have been sexually abused, and as Roberta suggested, when children's body have been violated, when their boundaries have been violated, Zoli is in a safe way for the child, well, to begin to learn to understand boundaries, to be respected, to respect boundaries, without having to put it all in words. We always want therapy to be a place where the child feels accepted and not judged. And at best, we'd like therapy to be a place where the child wants to go, where they enjoy going. And Roberta has kids who come in on the day when Zoli is there, and they're excited from the minute they walk in the door because they have an opportunity to interact with her, to take care of her, to groom her, and they really get a lot out of that in terms of the contact. So, children who have witnessed domestic violence, children who have been sexually abused, we do some work with children who have been physically abused, but I think any of those populations can benefit from animal-assisted therapy.
Roberta, when you engage the child with the dog and they develop a relationship, how do you then move that into the therapeutic system so that it moves beyond just play with the dog?
Well, first it's building the trust, and that is also work, because for a lot of these kids, one of the things is to help them trust again and feel that the world is a safe place. So we have a lot of conversations about, what would Zoli need to do if she went someplace? What would she need to feel safe? And they can identify her needs very easily because it's not about themselves. And her needs and our needs are not that much different. So then, we ask them, and what would you need? So it's a really gentle way for them to start identifying their own needs, which were never really recognized, and they didn't even know that they had a right to have their needs met. And then each child might have different issues. Some children have a really hard time with boundaries. The kid who comes into the office and who is under my desk and behind my chair, they really need to learn about personal space and, working with Zoli. And you can't just come in and, glom onto her. So they really learn to wait and watch for cues as to, when is it okay, which will help them socially, because a lot of these kids, there's no boundary between me and other. So it helps them in their world as well. For some kids, they don't know what it's like to have feelings. And so to ask them, how do you feel, it's sort of like asking them, what did you do on the moon? So, but they can look at Zoli, who happens to have a really expressive face, and, say she feels she's sad. Why is she sad? And the answer is usually about why they might feel sad. So then, for example, one kid said she's sad because she doesn't have anybody to play with. This was a boy who had been sexually aggressive, who had nobody to play with. And then, so do you ever feel like you have nobody to play with? And what does that feel like? So it's kind of like a way in where they don't really realize that, they're talking about themselves.
Right.
Yeah.
How long might a child stay engaged with the dog? Is it an ongoing each session, or do you time limit and then sort of wean somebody off the treatment with the animal?
If somebody comes in on a Wednesday, which is that day, she is part of the treatment. So she's there every Wednesday. I mean, some Wednesdays, I know she doesn't feel like coming to work. Like sometimes I don't feel like coming to work, but she has to come because that kid
You want
is.
to get your salary. Yeah.
She's a very good worker, and she's got a great work schedule, 1 day a week. But, the kids are looking forward to seeing her, and they come expecting, I have to feed her now, and, so they feel important. They've never felt important before. So she is part of the treatment, and when the kids are finished with therapy and we terminate, or end the treatment, she's part of that ending.
I see. So it
Yeah.
wouldn't be that, you have 6 weeks with the animal and then move on to something else. That's part of
Right.
the whole treatment.
Yeah.
Are there any special goals that you set when you establish sessions that involve Zoli in the sessions?
The goal would be dependent on, like pretty much each child comes in with like a pressing issue. So, for a sexually aggressive kid, probably, the primary goal would be just teaching them about how to control their impulses and delay gratification. So they might say, I want Zoli on my lap. I want her to sit on my lap. And it's like, first of all, would you go and sit on somebody's lap if they just asked you to? So they kind of get to see, what makes sense and what doesn't. And they really have to learn, that sometimes they have to put somebody else's needs before them. So that's one type of kid. Another type of kid, I'm amazed sometimes when I ask kids, where do you feel safe? And one girl said to me, what does that mean? So, for her, the goal is to feel safe, and then what does she need when she goes to her next foster home to feel safe?
Right.
I mean,
Right.
some kids just don't know what that feels like, and if Zoli were not there, it would be really hard to put into words what it is to feel safe. But being with her, and physiologically a lot of things happen, research has been done, blood pressure comes down, and stress is definitely reduced. So there's a lot going on under the skin, too.
Right, right. Well, dogs aren't the only animals that you're using in therapy, and I was fascinated to hear about the Pony Power program, and maybe you can describe how you use other four-legged animals with another set of youngsters.
Pretty much, all types of animals, have been incorporated into animal-assisted therapy, but we're limited because, we're on Central Avenue, so we don't have a barn or stables yet. But there are a lot of places that do therapeutic horseback riding, or equine facilitated psychotherapy, or equine assisted activities. And there's a governing agency called NARA, so we looked around to find a center that would work with our kids in the safety net program who had sexual aggression issues. And we work with somebody in New Jersey, Dana Spett of Pony Power. She's a certified social worker and a certified therapeutic riding instructor. So we pick some kids that we think would benefit from that modality. Again, kids that just really need more than talking. And now a horse is a really big animal, so
Right.
like you don't know that. So for a lot of these kids,
I'm also allergic to horses.
well, we didn't bring our horse.
I can't do. Right, right.
But, a lot of these kids have abused power. And, a lot of these kids, a lot of them, their aggression is from fear.
Right.
And they act really, really tough when they're scared. And when you get around a horse, you can't act tough. And you can't get on the horse and, sort of have your attitude, So they really learn about how to work with the animal, not have power over, and, really master, their fear. Because for a lot of these kids, they can't say they're afraid. They live in Mount Vernon and they're afraid to walk down the street. They can't act afraid. They have to be really tough. And even in my office, they have to act really tough. But when you get around a horse, it's hard to pretend that you're not afraid if you're
Right.
really afraid. So we did some really nice work with a 13-year-old boy who had been sexually aggressive and Actually, we had found out that he was abusing animals as well. This work is also really good for those that abuse animals. So he came out and he was terrified, and it was the first time that he could say he was afraid and not act out in an aggressive way, but to just sit there with it. I happened to be there that day with him, and to be vulnerable, and then to talk about, well, what would have to happen for you to, you know, trust that horse. So it was such a learning for him that, you know, you don't die if you're afraid, and you don't, you know, have to act out.
Now, you also prepare the young people beforehand, before they go to the Pony Power program. What sort of education does it involve to prepare them to work with larger animals where they might actually be afraid and may not know how to be appropriate?
We use a lot of visuals, so we might have 1 or 2 meetings before groups with the kids and talk about the parts of the horse, you know, just give them some knowledge. And what does a horse need? So, you know, similarly with Zoli, it's always about what does the creature need, and we're building compassion, because a lot of these kids, you know, nobody cared about them, so they haven't had time to care about anybody else. So what does the horse need? And then each kid sets up a goal based on whatever they're working on in therapy. They set up a goal with their therapist, like, I want to work on, you know, and some might say, my fear of the horse. I want to work on not getting frustrated if I can't do something right. I want to work on having to wait my turn. And all of that is included. I mean, so many lessons just in one day. There's a lot of teamwork. The kids will come in and they'll work together to prepare the food and feed the horses and groom the horses. So it's a lot of compassion learning.
Are there some kids who are inappropriate for these types of interventions with animals?
I think if it's a kid who just can't control the anxiety. I mean, we had a little boy who was very, very anxious, hyperactive, 7-year-old boy. He had been abused. But on the horse, he was focused, and that was the one time he needed all his senses to focus in. But another kid might be so anxious and then get more flooded with the anxiety of having to try something new, and, you know, nobody forces them. We had a boy that came who was really afraid, but he agreed to try it, and he didn't want to ride, he didn't want to do anything, and we asked him to touch the horse, and he went like this. And I don't even know if he touched the horse, but, you know, he tried.
Right.
So some kids, you know, that's as far as they can go, and that's okay.
If I could just add something about the animal-assisted therapy, it's really not just about the child, it's also about the family. One of the things that Roberta did actually before taking the first group of children to Pony Power is she had the children and the families in, and of course the parents have to sign a consent form. But she had them come in and did an educational program with them about what she would be doing, about what the needs of the horses are. I think the other thing to keep in mind is very often these are families where the only time they get called in to see somebody about their child is when their child is in trouble, whether it's with law enforcement or school or neighbors' parents. And here, these kids are coming in and really having a major accomplishment. They're taking a course, they're learning to horseback ride, they're learning about the horses. We've actually taken photographs in the beginning, we videotaped some of it, and the families actually then, when the children complete the program, have a photograph of the child on the horse. They have a certificate of completion. The families come in at the end for a picnic with the kid, actually at the stable with the kids, with the staff of Pony Power. And even just when you see the photographs of the children on the horse, they look like different kids. Their posture is great, they're smiling. So in addition to the benefit to that child in the moment, it certainly is a very different experience for the families in terms of taking pride in this. And then they have this framed photograph of their child, which they can remind them of the positive experience.
Now, we only have a couple of minutes left, but you've also opened this up to young people with developmental disabilities, I understand. How, just in 2 seconds, maybe you can explain how that helps that population as well.
That population, you know, feels different, knows they're different. So when Zoli comes in, Zoli doesn't know they're different. You know, she just accepts them like she accepts any other group of people. So we did a couple of groups with adolescent social skills, developmental disabilities group. And, you know, for them, learning that you don't have to go and approach the animal. You can wait till she approaches you because there was some impulse control. But she has a very good friend whose name is Piglet. She's another pug. And we had Piglet come in, and there was a lot of vying for attention. So we pretty much just observed the interactions, and Zoli would go over to somebody, and then Piglet would come over and push her out of the way. And then we asked the kids what happened, and they said that she felt left out. And so one of the boys started talking about how left out he feels in his environment because he wants to be with the mainstream kids. And so there was a lot of support from his peers, and then we talk about how can you make friends. You know, even though you feel left out, how can you take some baby steps? And they, you know, they learned a lot. They learned a lot and felt very accepted.
So this is really a catalyst for discussion and the children learn skills, and then also, I guess, once they feel comfortable with the pets, they can translate that into feeling more comfortable with adults and trusting others.
Right.
Okay. I understand that there's a training program so that if people who have pets want to get involved in this, they can. We have 2 minutes. You can give us a little information about that.
Mercy College in Dobbs Ferry has a certificate program in animal-assisted therapy, and you do some actual hands-on work with the horses. You learn a lot about animal behavior. You can't do animal-assisted therapy unless you really know your animal. I told Pat, I think Zoli might be stressed, and Pat said, I don't think so. You know, so you really have to know, you know, what stress looks like in the animal. And so you learn a lot. You spend a lot of time at the farm with the animals. They co-sponsor the course with Green Chimneys. So you get to go up to the farm and do a lot of observing of animals.
But now people who want to do that, that is for therapists who want to do it, or is there a paraprofessional type of certificate for people who have pets and feel that they can use their pet in a therapeutic way?
I think this course, you don't have to be a therapist. I mean, it certainly helps, but it's like a program where you'll have a psychology course, you'll have a course on special education. You know, they'll build some courses around it so you have experience working with different populations. But it's good, you know, to have some good clinical base as well.
Right.
Yeah.
Well, it's certainly very interesting to hear how this new and very interactive therapeutic method has been integrated into our services. And I think, are there any other, you might want to just sum up?
Well, actually, one of the things we're learning in working with trauma victims is the expressive therapies, art therapy, movement therapy, dance therapy, are really becoming much more understood as a helpful way of helping people heal from trauma. And animal-assisted therapy, I think, will be a part of that picture because it's a way of people healing without re-experiencing all the pain, but it certainly promotes growth and healing from painful experiences.
Okay, well, it's wonderful to see that we're looking in all directions to help children feel safe and to find ways to reach them and to integrate it into a therapeutic setting. We're going to be talking in our second half again with Pat, and I thank you, Roberta.
Thank you.
And also, I want to congratulate you on being receiving an award from the Task Force on Child Abuse and Neglect, and I think your work is so exciting and so helpful to people in our community. We really have to thank you for what you've done.
Thank you, but I also think it's great to be working for an agency that embraced this.
Okay, well, thanks. And stay tuned. In our second half, we're going to be talking about keeping children safe and helping parents understand how to help their children be safe in a not-so-safe world. Welcome back to the Ways We Care of Westchester Jewish Community Services. I'm Dale Wang, Director of Community Relations. WJCS is funded by government grants, private foundations, individuals, and corporations, UJA Federation, and United Way. We live in a time when it is hard to feel safe, even in our everyday lives. Not only do we sense our vulnerability to terrorist threats, but we are increasingly aware of the vulnerability of children and adults to sexual predators in our neighborhoods and over the internet. It is difficult to convince ourselves that we are safe at airports or on trains, or that our children will always be free from violence in their schools or places of worship. Recent episodes of a young girl abducted, raped, and murdered in Florida, and closer by, a school lockdown in Bedford when a group of criminals was on the loose, heightened anxieties about the safety of our children. When the world seems so violent and the potential for danger lurks so near, how do we find the strengths and supports to enable us and our kids to find safety and trust again? WJCS's Treatment Center for Trauma and Abuse helps people cope with the aftermath of situations of violence or abuse. One of the directions our staff has taken is also to educate and prepare parents and school districts so that the possibilities for abuse may be minimized. Tonight we're going to talk about some of the ways in which we're trying to help parents and school districts prepare children and better be aware of the situations and how they can help children to feel safer. We're going to be speaking again with Pat Lemp, who is the director of the Treatment Center for Trauma and Abuse. Thanks, Pat, for being with us. And Froma Benaroff, who is the CSW and supervisor of the Peekskill branch of the Treatment Center for Trauma and Abuse. Froma, welcome. Pat, Froma, many parents today are looking for answers and trying to find a balance between the instinct to protect their children and the necessity of allowing them to function in a world that is not so safe. Is it possible to keep their children safe in our current climate? You know, what are you telling people who are afraid?
Well, I think your question is a complicated one, Dale, because of course we want to believe, and certainly as parents, that we have the ability to keep our children safe at all times, but the reality is now there are more dangers or different dangers than there were in the past, but we don't have the ability to keep our children safe at all times. We have the ability to try to educate our children realistically about what the dangers are. We have the ability to approach this situation calmly. We have the ability to help children to talk about things that are not easy to talk about. But it's really important to recognize that when children are hurt, when children are abused, it's not because they or their families have done something wrong. People who do these things to children are quite sophisticated and planful in how they orchestrate what they're going to do. So kids are vulnerable to being hurt.
Mm-hmm. So try as we might, we can't always be the protective parents, and we can't always make sure that they're safe.
Yeah, I think it's important for parents not to blame themselves if something does happen, but also to have a support group for themselves and have a way for them to talk about their own fear and anxiety, because I think it's very important for adults to keep that kind of fear and anxiety on the adult level so that they can communicate to their children a sense of calm, a sense that they're in control, a sense that they can keep their children as safe as possible. And that way the children know that the parents are in charge and that then they feel more safe and protected.
Mm-hmm. One of the things that came up is that most children are not abused by strangers. And I think that was a very interesting aspect. People don't tend to know that. We're so afraid of outsiders.
Well, the stranger cases are the ones that tend to get a lot of publicity, and they are realistically very frightening. The case in Florida was just horrible, when we saw that videotape on television. But the reality is that more than 85% of children who are sexually abused are sexually abused by somebody who they and their families know and trust. So, you know, we all grew up with messages of, you know, don't take candy from strangers, don't talk to strangers, and in some cases that's useful information, but it's not adequate, it's not enough information, because if kids grow up staying away from strangers, it doesn't necessarily help them to be safer in other situations. So it's really important that we re-examine what message we're giving to children and try to figure out how to communicate it to them in an effective way so that they are aware of where the potential danger can be, which is really any place, in the home, in school, in a church, synagogue. We have gotten smart enough to learn, unfortunately, that people who abuse children come from all walks of life.
Mm-hmm. What do you tell parents and schools to help them minimize the possibility that children will put themselves in situations where they may be endangered?
One of the things that I try to work with parents on is creating communication, open communication with their children. We know that if abuse happens, and it happens once and the child feels comfortable to talk about it and tell their parent right away, that the success and healing takes place much more effectively. Whereas if a child is afraid and keeps the secret, then it becomes a more complicated dynamic and much more difficult to treat. So I really talk to parents about keeping open communication, and one of the things that I suggest to them is a what-if game, where they do a what-if to their child, like, what if I'm late picking you up at school? And then the children develop the answers, and that gives the parent an opportunity to help them have that plan. And then ask the child to give them a what if. You can really learn what is making a child frightened or what is bothering a child or what's on a child's mind by saying, so now it's your turn to do the what if game. And then they have a chance to pose that what if, and the parent has a chance to help them set up answers and safety plans so that they're at all times at least aware of what the parent would like them to do in those situations.
Mm-hmm. You mentioned safety plan, and I guess I was reading an article over the weekend where they were talking about how being prepared helps the entire family feel a little bit more comfortable, a little less anxious about what could happen. What should go into a safety plan for a family?
I think it's so dependent on the family's values, and I think that's what we need to listen to, is to what will be a comfort level for them. I think to always kind of know what your parent's telephone number is, to always let the school know if your cell phone changes. You must kind of keep the people in your children's world aware of it. If you're going away, you need to let the children know exactly where you're going, what you're doing, and who's going to be in charge. I often suggest that there be a family password so that if a plan changes and the mom or dad or a caretaker is not picking up the child and someone else is, that person knows the password, and that the child not go with a person unless they know the password. So I think being honest and open with children, I think children deal really well even with scary things if the parents are saying, this is what we're going to do and this is how we're going to do it, and give them a sense that they're in charge and that they're not as frightened as they may feel underneath it.
Mm-hmm. Can I just play this out a
Sure.
little bit? If you have a password, if someone comes and doesn't have that password, how is the child taught to react then in that type of situation?
You would say to your child to let the teacher know that you have a family password and this person isn't using it, and that you can't go, and that the child can't go with them, and then whoever is responsible at the school or the community center, wherever they are, can then help the child and contact the parent, and certainly not let them go with someone that the child feels uncomfortable with.
Uh-huh. Okay. You also had mentioned teaching children to say no, and I guess that's a difficult thing because we teach our children to be obedient, and that adults, they should follow what adults say. And in some of these situations, we're saying it's not appropriate to say yes and go along. What are the guidelines that you give to a family or to a child when you want them to know when it's appropriate to say no?
It's really important for children to be empowered to identify their own feelings of discomfort and to be able to say no. And I tell the families, especially now that I'm a grandmother, I tell the families that they should practice with their loved ones, saying no, so that if it isn't that if the child says, I don't want to give grandma a kiss, they say, oh, grandma's going to feel so bad, please give grandma a kiss. I think that's really not the way to help a child to feel empowered, but to say to the child, you have a right to say no, and if you don't feel like kissing your aunt or your uncle or your grandmother or your grandfather, then what else can you do? Can you give a high five? Can you throw a kiss? I mean, in our family, we do a lot of throwing hugs and kisses, and when kids don't feel like doing that. And I think it's an important message. It's very hard for some families because their sense of respect for adults and respect for elders dictates that, you know, children should be respectful, but I think it's really important to help children understand that they can be respectful and say no at the same time, and that the best place to practice is at home. Because if you can say no to someone that you love very much, then you can certainly say no in many other situations.
You had also mentioned teaching children to trust their instincts, and I guess sometimes you want to say no. I think we had talked a little bit about situations where someone might be chasing a child, some kids might be chasing a child and putting a child in an uncomfortable situation where they may want to say no, but they yet may know that if they say no, they're going to get into more trouble. These are very difficult boundaries for children to learn. How do you transmit that?
We're actually talking about a difficult situation because, you know, if you think in your own life of times when you felt in danger or threatened, it's kind of that fight or flight instinct that kicks in. And sometimes, and what Froma's been talking about are important kind of building blocks or a foundation that we want to help parents lay with the children or schools to lay in terms of giving children the ability to ask for help, giving children a voice to express their feelings. But sometimes in a crisis situation, the child or adolescent really needs to figure out very quickly how to survive that situation. And the goal becomes survival, and that will mean different things in different scenarios. And so what we would teach a child is really to do what they feel will keep them safe, so that if they feel saying no to the bully in school who wants to take their pen is going to keep them safe, then that's what they should do. If they feel, you know, telling the teacher is going to keep them safe, that's what they should do. If they're on a street and a stranger comes up to them, rather than stopping and engaging in a power struggle of saying no, if their instinct, and hopefully it would be, to run away as quickly as they can and call out for help, that's what will try to keep them the most safe. So it's important to, as Broma suggested, play out different scenarios, try different role plays, so that if any of these situations come up, it's not totally foreign for the child. The child remembers, oh yeah, we talked about that, and that's positive, and I have a plan for what to do in that situation. We also were talking about communication, and I think that's really critical, that we somehow have this notion that if we talk to children about sexual abuse, or if we talk to children about child abduction, that they're going to be overwhelmed with it, or they're going to be frightened by it, or they're going to make up stories about sexual abuse. And yet, when we think about it, in other parts of our society where there are dangers to children, dangers from fire. You know, if you think about schools are regulated to have fire drills many, many times a year. And, you know, fires are tragic things, and I don't want to minimize that, but the statistics of a child who's likely to be hurt in a fire are much, much lower than the statistics of, for instance, a child who might be sexually abused. We know that 1 in 4 girls and 1 in 7 or 8 boys is sexually abused before the age of 18, yet we don't seem to work out the communication to be able to talk to children about this, to help them be at a minimum prepared for the possibilities of what an adult might do to them in an exploitive way.
One of the things that we always find is that as little as a year old, you're teaching children where's their ears, where their eyes, where their nose, and when it comes to their private parts, they have funny names, and we really encourage families to use the words and to let the children be comfortable using the words, because then they can in fact talk about it, and it's not something that's, you know, something that we don't talk about. So.
Right. And if they're not comfortable with the appropriate words, saying to a child, your private parts are the parts covered by your bathing suit. Although bathing suits have gotten a little different, I think they still cover the private parts. And it is a way of communicating to children what will happen, because if we know, again, aside from the minority of kind of violent predators who abduct kids off the street, for the most part, people who sexually abuse children actually groom them or do it in such a way that the child is tricked and manipulated into feeling like this person is their friend or somebody who's going to take care of them. And if that happens, and if the child is not physically hurt immediately, they get very confused about what's going on, so that they have information. If their mother has spoken to them about something like that happen, or their teacher or their father, they at least have a frame of reference and then the ability to tell somebody about it, which is really the best we can hope for in a situation like that.
Mm-hmm. Yeah, I guess that was going to be my follow-up question. How do you establish that kind of atmosphere where a child can talk? Let's say an incident does occur. What should a parent be saying to enable the child to trust them enough, or not a parent, some other adult figure, so that the child will feel comfortable to come back and report an incident?
Again, I don't think it's so complicated, at least from the child's perspective. You know, how do we communicate to children not to run out into the street? How do we let children know to tell us when they have a stomach ache, when other things are going on? If we're able to communicate, to allow children to express their feelings, and then communicate to the child that if anybody, and when I say anybody, I mean anybody, like somebody who you don't know, and be very specific, somebody in school, somebody at Little League, somebody in the community, somebody in our church group, ever makes you feel uncomfortable in any way, if you get like an uh-oh feeling in your stomach, if they ask you to do something and you're not sure if it's okay, sometimes adults get confused, sometimes they're not sure about things, but if you get that feeling, or if you're not sure if it's okay, I just want you to tell me about it. So the message is, it's okay, it's not a big deal, I'll take care of it, is what you want to communicate to the child. It's also really useful to say to the child, particularly if it's coming from the mother, and if I'm not available, or if you can't tell me, who else might you be able to tell? So that the child has a resource of 2 or 3 or 4 people, so that if very often children don't want to tell their mother, for maybe they've had some threat against their mother, maybe they feel protective of their mother, but if they have other resources, maybe they can go to an aunt or to a neighbor or to a close friend, and with your permission to do that, they're more likely to tell.
I think also encouraging parents on a daily basis to respond in a calm way, as we had said before, because if a child comes home and has fallen down and torn their clothes, and the parent gets really upset. I'm not saying that they should praise them and say that's great, but I think if they respond to those things in a calm way and in an informative way, that will give the child the message that they really mean that they can talk about anything. Lots of times we say to children, you can talk to me about everything, except the kids know exactly what they can talk to you about and exactly what they can't talk to you about. So I think that parents' comfort level is easily communicated, both verbally and not verbally, to their children, and so to really create an environment where there is an openness and where there is not a criticism or a judgment, but a thank you for telling me that. I think that's a really important thing to say to children. Thank you for telling me that, because that really communicates that the parent is pleased that they heard it.
I'd like to move on to an area that has caused safety concerns that we probably hadn't expected 5 years ago, and that is internet safety. There are very positive aspects of the World Wide Web, but there have also been alarming situations where youngsters get engaged and lured by people, and they have met them by computer and then end up in very uncomfortable and distressing situations. What can parents do today, where that's really another marketplace for predators, to protect their children?
It is of great concern, and in this county especially, I know that it is of great concern, and they're addressing it. I think, for starters, computers should never be in a child's bedroom. They should be in a common area where people are coming in and out, so that it's not hidden away. I think that parents should monitor and actually walk by and see what their children are doing. And I think, again, it goes to communication. With this, you know, children are always saying, you don't trust me, you don't trust me. And it isn't about whether the parent trusts the child. It's really about that these people are sophisticated and children are not. Children are vulnerable, and parents are there to help keep their children safe. So if a parent is questioning a child about what they're doing on the computer, they need to say, it's not because I don't trust you, it's because I don't trust what's out there, and that I want to help you to keep you safe. So that's the message that needs to be communicated to children when you are checking on them and seeing what sites they're going to. I think the blocks are very important on the computers. We should all know how to get them, and if we don't, if the parents aren't as computer literate as the children, which is often the case,
I think that's the case, yeah.
we need to make sure that we become informed and find someone who can help us put blocks on the computer. I think being on the computer for hours and hours is not really a great thing for kids, so I think the time should be limited, just as time on television might be limited. And I think that talking to kids about what they're doing on the computer is very important. The other thing is no personal information. Children need to understand that they should not give any personal information. There was a case where a child was in a chat room and didn't give their name, but had mentioned that they were going to a football game, and then this person asked them what were the school colors, and the child typed in the school colors, and immediately that child could be found at that game on that day. And kids need to be aware that they need to be really careful about what they're putting into that computer and what they're communicating about themselves, their family, what their activities are.
Mm-hmm. Pat, are you finding that there are more and more of these situations where children have been, the initial contact has been through internet connections?
We are certainly hearing that it's almost like a new group of child molesters, pedophiles, for lack of a better term, in that there's a new way to have access to the children. So increasingly there are people, adults, primarily men, setting up or trying to work through this vehicle to have access to children. Fortunately, in Westchester County, the District Attorney's Office is very active in operating, in getting on investigations, trying to find these men, and often these are men who will try to set up a situation, and they'll actually be talking to somebody from the District Attorney's Office who's posing as a child. So it's really primary prevention in that, there's not the opportunity to victimize the child because somebody's going on the internet searching for a child and they're intercepted before that happens. So that's kind of the best scenario. But certainly in our program, we have seen a handful of children who have been lured or pulled into very uncomfortable situations in this way. So it's a new vehicle for abusing children.
Mm-hmm. Do you find that schools are now starting to address this issue? Is this something that's coming up through the schools, or you haven't quite yet seen that?
So many of the schools have computer programs, and so I think they do. It's different from district to district. Some are doing a better job than others, but I think everyone is becoming so aware of it that when they have computers in the school, I think the libraries are places that really parents need to pay attention to, because when kids are in the libraries, they're online as well. So I think that we just need, as helping professionals, to alert parents to these possibilities and to monitor in a safe way, but in a respectful way of our children.
Mm-hmm. Reality, obviously, is that we can't guarantee our children's safety, but what steps should parents take if they suspect that their child has been abused or exposed to a dangerous situation?
It depends on the situation, but it comes back to what we've been talking about, and that is communicating with their child. If they suspect their child has been abused, if they see changes in the child's behavior, if the child is suddenly not sleeping well, afraid of a particular adult, respecting that, asking questions about it. And if it seems beyond what would be normal kind of anxiety, and that's different from child to child, but a child who normally sleeps well, having many sleepless nights, a child who has been toilet trained, suddenly having problems with enuresis, a child suddenly afraid of people who they were familiar with and feeling safe with before, might be an indication that something more is going on. And the parent should ask the child about it in a very gentle, supportive way. And if the behavior persists, or if the child says something of concern, then the parent should seek professional help.
One of the things that I think is really important is that parents don't feel they need to be investigators. When Pat says ask general questions, sometimes parents don't know what questions to ask. I think their important role is being a good observer and really noting what changes have taken place, what they're concerned about, what worries them, and then, you know, calling and asking for some help in assessing, is this a serious issue? Is this something that, you know, they're overreacting to, or is there some really a more serious problem? So they need to be good observers and not become their children's investigators.
Right, and also not be afraid to say this has happened to my child and to seek assistance for it.
Exactly.
Actually, I often get phone calls, and the rest of the staff does as well, from a parent who says, you know, I just saw a TV show, I'm seeing this type of behavior in my child, do you think it's problematic? And we'll have a detailed conversation, you know, what have you seen, what have you said to the child? And the next step may be bringing the child in, the next step may be the parent asking more questions, or in the best scenario, the next step may be, sounds like the child is fine and age appropriate, and this just may be a developmental stage that the parent wasn't fully prepared for. But certainly a phone call just to kind of talk things through can be very helpful in many situations.
And that call can be made by anyone who's viewing this program to the treatment center.
Yes.
Okay. Because we only have 1 minute, I'd like you to let people know how they might reach the treatment center and what types of assistance you can give.
Okay. Actually, just to reiterate that, you know, we all have the desire to keep children safe, but we know many children are not safe, many children are victimized, and it's never the fault of the child, and it's never the fault of the family. And when children are hurt, we're here to help the healing process happen, and we've seen many, many, many children heal and thrive and get better. And so for children who have been sexually abused, for children who have lived in violent families, for adult survivors of sexual abuse, they can call the program. We're at 3 different sites, but probably the easiest way to reach us would be at the Hartsdale location, and that number is 949-7699. And as I said before, our services are in the community in southern Westchester, in northern Westchester and Peekskill, and in central Westchester and Hartsdale.
Okay. Well, I thank you both for sharing your insights, because I think that parents are afraid these days. They're afraid for themselves, they're afraid for their children, and you've given some tips for how they can be better prepared and perhaps prepare their children better. So thank you, Froma, and thank you, Pat. And we hope that if people have concerns about their children's safety, or if you are interested in our pet assisted therapy program, you'll give us a call at 949-7699. Thank you, and good night.